And in ultrasound, a wider bandwidth is generally better because it contributes to a shorter pulse length, which we know is good for axial resolution.
Right. So wider bandwidth equals better axial resolution.
Exactly.
Okay. And then what about Q factor?
Q factor is basically a measure of how pure the frequency is. So a high Q factor means the transducer is producing a very narrow range of frequencies, which is actually not ideal because it results in a longer pulse length.
Okay, so a high Q factor means a narrow bandwidth.
Right.
Long pulse, bad for axial resolution.
Got it. We actually prefer a low Q factor, which means a wider bandwidth, shorter pulse length, leading to better axial resolution.
Okay, so lower is better when it comes to Q factor.
Right.
Okay, now let's talk about beam characteristics. What actually determines the shape of the ultrasound beam?
Well, it's influenced by a few things: the size and shape of the piezoelectric crystal, the frequency of the sound wave, and then whether we're using any focusing technique.